most of whom are on our schedule for today. Welcome to our July 9th, 2024 Board of Douglas County Commissioners' second day of budget hearings. So we are starting with behavioral health partners. We will move to, at 10 o'clock, targeted populations. At 11, we'll have health and human services, and 11:30, we'll have some admin and some core functions that we'll talk about. For our behavioral health, we have a number of partners that are going to join us. We may not have room for everybody at the table, but we'll do the best we can to get folks up to a mic. And I think, Bob, are you going to kick us off with some kind of general comments? Okay, thank you.
Good morning, commissioners, and good morning, everyone. As I was looking around the room this morning, I was thinking about where we were about 6-7 years ago, where this part of the budget hearing process, we had about 8 people at the table, and we had some spirited conversations about ways that we were collaborating. Look out in the room today, and half the room, or most of the room, is filled with our behavioral health partners, which is terrific, and a lot of gratitude. We won't introduce you all by name, if that's okay. But for those of you who do get questions, I think it would be great if you started with your name and what your position is, and we'll go from there. This budget, of all the budgets that we've presented to you, I think is the one which is in some ways most exciting because it presents a bunch of opportunities that we never imagined would be possible with the behavioral health sales tax when it passed in 2018. There are pieces of this budget that speak to and significantly address supportive housing and the goal of reducing chronically homeless, to reach functional zero for chronically homeless individuals by the end of the next 5 years. When we first started, we were talking about providing mental health crisis services. This budget and the work that we've done over the last 5 years significantly addresses the needs of individuals who struggle with substance use disorders and addresses equity gaps across the system in a lot of different ways. And we've made so many pieces of progress over the last couple of years. The TRC is online, but we didn't just build a crisis center, we built a treatment and recovery campus, and there's a proof of concept for the idea of having multiple tiers of supportive housing. In the last community health plan, we focused on reducing the number of opioid prescriptions, and we more than surpassed twice our goal. If you go to the emergency department and you ask them to give you data on how many people come into the emergency department today compared to how many people come into the emergency department 5 years ago, in the midst of behavioral health crisis, that number has decreased by 27%, and that was before the TRC opened. We have been collaborating now in a focused way on particular individuals who really struggle chronically in the community. The result of that collaboration in the last 7 months is an individual is our highest utilizer of jail services, who over the last 7 months stayed out of jail. They went from being in jail every day, every other day, to being out of jail. My point is just that the work and the collaboration and the experiments and the trial and error has yielded really significant results. And so what I'm excited about this morning is to take the proposals that our behavioral health partners have submitted and to try to work through where there's opportunity to increase what we're doing by more effective leveraging of the Behavioral Health Sales Tax Fund. And so we'll go from there, and I'm gonna work pretty quickly. I don't wanna read this to you, but I do want to highlight those 3 areas where things look a little bit different. So one is in the area of, here we go, can everybody see that? Do I need to make it larger? So those 3 areas that will focus on our supportive housing. I want to talk a little bit about how this budget proposes to invest in closing the gaps in the cost of psychiatry. And then the last piece is to talk a little bit about how we as partners continue to meet the substance use disorder needs of people in the community in an even more collaborative way. If you look at the priorities here for prioritizing prevention, these elements are very consistent from what they've been over the last couple of years, with the exception of the conversations we've had over the last couple of weeks about zero suicide and moving the leadership of that from headquarters Kansas to Lawrence Douglas County Public Health. So, the line item there's a recommendation to not exceed $85,500. That builds on the amount that's been in the budget for the last 5-6 years, and then builds an additional $58,000 in the event that we find the person to be that coordinator and would need to pay for that in its entirety in 2025, but the understanding with public health is that they also will be part of the funding braid, and we are going to have significant conversations that have already started with the state to leverage some of the funds that have been directed to other organizations to Lawrence Douglas County Public Health, so we can continue to lead in this work in a unique way, which is to address suicide and to implement zero suicide across all of our behavioral health partners. Under promoting integration across the system of care, things stay consistent with where they were last year. The Assertive Community Treatment team at Bert Nash has $200,000 of support. Remember, these were dollars that were redirected from what used to be health insurance dollars. There were a couple of places last year where we specifically targeted those dollars to specific programs at Bert Nash. The Assertive Community Treatment is one of those. Data integration and collaboration, we have been working for a number of years to support efforts between Lawrence Douglas County Public Health and the University of Kansas to build a data repository. That has been a project that's moved more slowly than we had hoped, but we're going to continue to keep $30,000 earmarked in the budget to be able to access as that work continues. Those dollars are now not specifically directed to Lawrence Douglas County Public Health because they could go to efforts with KHIN, they could go to MyRC. So the number stays consistent. It's now on the line in Behavioral Health Projects Administration. So as the need arises, we can bring a proposal that makes sense at that time back to you for approval. We're maintaining the funding level for the Douglas County Crisis Line despite the turbulence that's happening and the uncertainty that's happening at headquarters Kansas, who has been our partner prior to this for that work. As you know, we were talking about new collaborations between Bert Nash and the ECC. We anticipate that there will be costs involved with that, but there will be, we're budgeting so there won't be any new costs, and the reality is, like Bert Nash has been successful at leveraging a grant to help offset the cost of developing that co-located call center, and so that's why that line stays the same. The lived experience integration, so that's funding for Alive Inc., the new consumer-run organization. It supports Peer Fellows program. It supports our peers on the Heartland RADAC Care Coordination team who are starting to outreach into a peer-first response. So working directly with Lawrence Police Department, visiting DARE on a regular schedule, sort of getting out into the community and being the first point of contact to build rapport and get people into services and referred to the organization that they need to work with. I've been really proud in that program that over the last couple of years, the organizations that we've partnered with, now include in the Peer Fellows program, Just Food, Senior Resource Center, that's a potential target, county libraries, supportive housing initiatives.
Just a reminder that we have a lot of partners, a lot of questions to get to in an hour.
Thank you. So let's talk about supportive housing. Let's just jump to where there are new. As Sarah shared yesterday, there are 4 one-time capital requests in this list of priorities. They total $2.8 million, and they are the transitional housing project at DECA's Lakeview campus, the one-time capital for Cardinal Housing Network, 9th Street Baptist Family Promises supportive housing project, and a family shelter at $750,000. Then there's operational support at $1.3 million to continue to support programs like Artists Helping the Homeless, Kairos and Meraki houses and transitions, and for tenants to homeowners. There's a supplemental request to create a locally sourced supportive housing voucher program, which would allow people who are not able to access a voucher from HUD because of situations that exclude them and shut them out of that. And so that is the supportive housing piece. Treatment and Recovery Center of Douglas County, this is a reduction from the last 2 years because of the success we've had in braiding funding. So this year, instead of a $2.8 million request, it's a $1.6 million request. Improving access to care, I want to go down and highlight psychiatric infrastructure. In the past, the request for this section has been targeted at particular providers. Burt Nash and Heartland asked us to take a look at and to start to talk about this type of funding by looking at the overall costs of med services at both agencies and looking at the gap and offsetting the gap for the overall program. So in the notes, I'll indicate it that this recommendation represents a 40% offset of the deficit at Heartland and 69% offset of the gap at Burt Nash. This does not include Burt Nash's supplemental request, but we feel like, if we're staying consistent, we want to get to a point where we're offsetting a deficit gap. And so this gives us an opportunity to fund this section in a different way. And then the last piece of this budget recommendation that is different is in the area of substance use treatment. When we started doing this work together several years ago, each of our partners proposed different projects. DECA proposed a social detox access project that was very successful. Heartland was the only agency in town that was able to do MAT. And so what we're proposing to do is to work in the second half of this year to take the overall costs of our SUD investments, increase the dollars that are available for MAT treatment, because people can now receive MAT or a component of MAT at the TRC. They can receive it at Heartland. They could receive it at Mirror Inc. And we want to have flexibility so that the funds are accessible and usable based on the need and where a person chooses to have their treatment and their services. RAP stays the same, and so we have a summary at the end of what is new spending, proposed new spending here in 2025. It's the capital support for housing. It's the one-time offset for zero suicide. It's addition and to bring a new partner in the SUD space in Mirror Inc., and they are here today. They're a new partner, or a new proposed partner in the work. Increased treatment for medication-assisted treatment, increased funding for psychiatry at Heartland, and a supplemental request to create locally supported supportive housing vouchers. With that, I will let's ask the CEOs of each of our.
Actually, let's start with us. Commissioners, who would like to kick us off?
Just had a quick question, Bob. Thanks for that overview. A quick question about the Heartland Community Health Center psychiatric infrastructure. On our budget options, it's not listed as included in the proposed budget, but I think I just heard it was.
I think we had a snafu on whether or not it was included or not. I'll just have Cammie verify that we got it added, or Brooke, if it got added to the community partners budget, it just may not have gotten labeled right.
Because it's in mental health, yeah.
Okay, yeah. It is included.
It is included, thanks.
Hey, can you make a note of that if we're going to revise the budget option sheet?
I have a question that I think we can either get Heartland Radack to answer, or Bob, if you want to come on up. It's a question.
Do you want to call like a group of them up, or do you want to just do random? I just am worried about people randomly running up and back for questions. So do we want to figure out if anybody else has Heartland Radack questions and supportive partners up?
I think, come on up. I have a question for you.
Okay. Just trying to make sense of it.
Right. So in terms of, you have a supplemental request for peers, but there's also, kind of an overarching expanded peer positions in the Bob's budget for the 230,000. Is that included in that, or is that separate from that? Are you working collaboratively around peers, and that's where this is?
Yes.
Okay.
That's an accurate statement.
So that supplement is not specific, okay. Thank you. I had that question.
What I would say to that, though, is that we have been consistently working with Heartland Radack to expand the number of peers and where they are deployed. And so at the moment, if you were not to fund that supplemental, we would be able to continue to work with Heartland Radec in the ways that we have, because the ongoing cost of carrying those peer positions are now being carried by additional partners.
Is it built in or is it a supplemental?
There's piece of the cost of that that's built in, and then what Heartland Radec is requesting is additional dollars for additional positions. It's not built in.
And that's not for peers. The additional part that is not built in is for additional ICC team.
No, that's not. No, it's for peers and for a COLA increase.
Yeah,
For
peers
the
and
COLA.
cost of living, yeah.
Which is COLA goes for the team.
Yeah.
That's what, so, but it's not
Yes.
peers.
We have one FTE for a peer recovery coach for 87,000. That's the peer position I was referring to. Is that related to our peer budget of 230,000 or not?
No,
Got it.
and it's
Okay.
not
Any
included.
Other questions about either peers or for Heartland Radec, commissioners?
So my question was about your COLA request, and the request is for 119,000. Is that only for those programs and those salaries for things that are happening in Douglas County? That seems like a large percentage considering the total amount so that's like
Yeah.
Yeah.
And you're not wrong in terms of that number. One of the challenges that we faced with the way that we have put this together over the years, we started in 2018. And if you were to break them down FTE by FTE, the 2018 person's salary hasn't changed from a funding perspective in 6 years. So that particular person is a much higher cost to us now than, say, a person that you've started to fund 2 years ago. So so that's how you see those costs looked at, because we've never increased our budget from a cost of living perspective since we've been funded by Douglas County.
Yeah, I wasn't able to figure out because when we look at the budget request detail, you have $5 million in budget for salaries for Heartland Radec, right? So figuring out what percentage you're asking for. So I'm trying to get to what percentage of salaries are dedicated to here in Douglas County, not for Heartland Radec on the whole, because I'm trying to figure out what the percentage is. We have a lot of COLA requests this year, totally understandable.
Yeah.
And yet I want to make sure, I want to understand the percentage of increase that you're asking for as it compares to all of our Douglas County organizations, including Douglas County as a whole, where we're looking at a 3% increase. When I look at a 3% increase on your budget, that's $25,000. That's not 119,000. So that's what I'm trying to get to. Where is the difference between my 25,000 and your 119,000?
And it might be better if I go back and send you some more detail on that.
That'd be great.
Just-
Thank you.
There'll be no problem at all.
Okay.
We'll go ahead and put that together for you.
Yeah, if you could just send it to us, Jason.
Absolutely.
I'll have a follow-up on salaries. So I do very much like it when organizations take advantage of the column for the current estimates for 2024. So we have the adopted budget and then, something that more of a, realistic take on what's actually planning to happen in 2024. But a lot of organizations had, and not just yours, had an increase in that salary line from the adopted budget to the current estimates. So in this case, it was up 100,000. Was that you added a new FTE that wasn't anticipated in your 2024 budget? Or is that,
No,
salary
we're not
increases?
adding an FTE to that budget. It's really a cost increase to employ people.
so beyond what was budgeted for 2024? Okay. And we're seeing
yeah.
that'll, others can anticipate this
You're
question
going to get a lot
also.
of head nods, I think,
Yeah,
around the room.
but that's, most organizations, they adopt a budget, and that's going to be the salary until the next adopted budget. So I'm just curious, why there were so many that moved significantly. I mean, enough that would have covered another position in many cases, so. But I will mark that as.
I mean, what I would say for nonprofits, we move slow at county government. I think they move a lot quicker.
Things in our world do move a lot quicker. Things change year to year, and that's what ends up happening.
So I just want to confirm what you said. You didn't add any FTE. Okay, so the change in your salary benefit from 24 to 25 is a 14% increase. So that's a 14% raise for all your employees?
No.
Okay?
Or, that's why, let me
Okay.
walk through an
I'd love the extra
explanation
detail.
that
Yeah.
I would
Okay.
be a poor historian to sit here and talk to you about, but I'm more than happy to provide that.
Okay.
And send it across so that you have it.
I appreciate that.
Yeah.
Any other questions for Heartland Radak?
Hello, good morning. I'm curious about the request for the peer recovery coach specific to LPD. Can you just help me understand a little bit of context behind why the specificity of LPD? I can assume highest volume of response, right, in the county of all our law enforcement agencies. And I'm curious about whether or not there's been a conversation about any funding from LPD or the city specific to that, if this represents a portion. And it's possible that in the midst of reading several of these in a row, I lost that detail. So I apologize if it's in here and it missed me, but I'd love a little bit of context for that.
Yeah, so it's conversations with LPD have been ongoing for, gosh, a year and a half maybe, to see how we can better support our officers in the field. And utilizing the resources that we've had with the peer fellowship program is sort of a natural step to be able to both use that program and expand into the Lawrence Police Department, which is, I would not say that they are our highest volume of direct referrals for our work, but they are the highest volume of indirect referrals for our work through the TRC, through the jail, through the homeless shelter, through all of those places that we get our people. And so the answer, I think, to the first part of your question is yes. The second part of your question is also yes, as we are having conversations about alternative forms of funding for that particular position as well. So that the police department and the city take on some resource responsibility for it.
And roughly, Commissioner Reed, what we've talked about is we spent a year developing peers that would have the capacity to do this type of first response work. And we've had conversations with LPD about how those peers could be deployed or referred. As we've had those conversations, we started off with saying we, in partnership and braiding funding between Heartland Radak and the county, the peer fellows, would share that cost. In this year, 2024, half the cost is being borne by that, half the cost is being borne by LPD and MOU that we hope is very ready to sign. And then next year, LPD would carry the cost of that peer, which has always been the model for the peer fellows, is we carry the cost to develop them with a partner and the hope that they will carry the cost moving forward.
Next question, or can I go ahead and move to a new partner? Heartland Community Health Center? Right. Hi, thanks for joining us. So a similar question, just in terms of kind of the budget overall, an increase, I haven't done the math here, but an increase from 10,007 to 11,005 from the 2024 adopted to current budget, and then another jump of $1 million to the 2025 budget request just for salaries. So the question is, are there new FTEs being added, or are those living adjustments?
You have to push the button. There you go.
Sorry. So when it comes to FTEs, we have increased FTEs as well as had to do some cost of living adjustments based off of cost analysis that we get from both our state and national associations. So we maintain competitive in wages. We've also had some outside grants that are unassociated with our funding requests that required us to hire FTE specifically for those projects.
Do you know how many FTEs you're adding either within 2024 or in 2025?
Specifically to be?
For the whole agency, because that's in your organizational summary.
I can get you a specific number. I don't have a specific number this morning, but we are constantly growing and adding new FTE.
Okay. Also, building maintenance, has a significant increase. Is that related to bringing on the new building?
That's correct.
Commissioners, do you have other questions? And we have a supplemental request also. Okay. Okay, and we,
I do, but I'd also like to invite Lawrence Douglas County Public Health here, because I'm trying to they have, is it okay, commissioners, if we invite them up? Because they have a request for mobile outreach for the unhoused, and I'm trying to understand here, I would think most of those folks would be covered by our FQHC, but we're having Lawrence Douglas County Public Health do it. So I'm just trying to understand what the partnership is between the two, if there's an opportunity to get some federal funds for that, but I may be misunderstanding it, so I want to give Jonathan a minute to talk about it and maybe Heartland to respond. Yeah.
Am I unmuted? Can you hear me? Oh, how about now? All right, there you go, green light. All right, hi Commissioners, Heartland, how's it going? So really that request, that supplemental comes from the Wellness Wednesday initiative that we started that Heartland actually joins us for. So we bring our mobile unit once a month over to LCS to provide the same clinic services that we offer at Lawrence Douglas County Public Health to guests at LCS at no cost to them. And each time that we're there, we have a community health worker from Heartland join us and helps to get them connected, the people that we see, to get them connected over to Heartland if that's what they want to do. And so the whole reason we're able to do the Wellness Wednesday initiative now is because we got a community development block grant from the city, and we expect to spend all of that probably by the middle point of next year. And it's been going really well. Even every time we show up, there's a new community partner there. So it's something that we wanted to keep going. So I don't know, Heartland, if you all wanted to add anything to that, but that's how so far we've been working together on Wellness Wednesday. I'm not sure, I don't have the numbers on how many people the community health worker from Heartland connected from Wellness Wednesday to Heartland. That I'm not sure of.
So last year, we served over 360 folks experiencing homelessness at our clinic. And you're absolutely right. We send out community health workers to help bridge the gap between access to care and really let those individuals know what the full breadth of services that are provided at Heartland, and also to address any transportation barriers to care. Several months ago, we brought a proposal about what it would look like to have more broad range clinical care from a street mobile outreach perspective, and there was not funding opportunity at the time for that proposal. But one of the challenges is in order for us to be able to do mobile outreach and provide primary care, it would have to be a location that's in scope. So we'd have to have our own mobile unit or have to put another location in scope. So it's a little bit challenging for us to do regular clinical care on a regular basis. It has to be intermittent for it to be considered in scope. So I don't know if you want to add any more detail to that, but it's something that we're really focused on and making sure that we're bridging the gap. And when it comes to funding, federal funding, we're constantly looking for opportunities. When we applied for our initial base grant as a community health center, there was not an opportunity at the time to add care for the homeless as a part of our federal base grant, but when that opportunity comes live, we are going after that opportunity. Right now, it's going to be a really competitive grant opportunity, so we're not in a high need area according to Health and Human Services, so it will be competitive. Whether or not we can get those federal dollars that may be released in July of 2025, but it is something that we are going after.
Maybe I need to be a little clearer in my question. What is this paying for? I wasn't able to grab that from your narrative, specifically what that cost is, because if it's cost for care, my thinking is that might be covered through Heartland. I now understand that there may be some federal rules that I don't understand there, right? But what is that cost there?
Jill can chime in here.
Jonathan, is this to continue to fund the APRN position? that's funded through those the
So
COVID
really,
CDBG
so
grant?
every one of our staff members who are there, so the nurse, the APRN, any labs that we would order, all of the clinic services, that's what we use that grant. We use that grant as like a payer, almost like as an insurance source. So,
And that grant is temporary from the city of Lawrence,
correct.
and any other clinic subsidy for public health comes from the county or the city.
Yeah, so
Is that what
basically
you're
it
trying
was-
to get at, Commissioner?
Sort of, yes.
Yeah, so look at it like this. So the whole reason that we were able to even do the Wellness Wednesday initiative is because of that grant. So now we're trying to figure out opportunities. That's why we put in the supplemental request to be able to keep that going so we can continue to build on that and keep contributing to the A Place for Everyone plan.
And I have concerns in that because my conversations with the city of Lawrence is that the city of Lawrence is responsible for emergent needs, and the county is looking at supportive. Housing. Yes.
And
That's
and
why
I
it
would-
wasn't funded and how it was rated in our budget.
And I would just add that we've been having ongoing conversations for well over a year in a work group, a small work group related to A Place for Everyone around medical care for unhoused folks. We've been using the Wellness Wednesdays and the pop-up clinics that have been happening as an outreach tool, and it's working. But we're also finding that there's a significant gap in services for folks, and how we meet that gap is constantly changing. So one of the things that when we were talking yesterday with the Mobile Integrated Health team, that conversation about mobile integrated health with LDCFM, we think there's a lot of opportunities to take what's happening with Wellness Wednesdays and some of the pop-up clinics and fill a need perhaps with the Mobile Integrated Health team. They don't have the capacity to meet some of those needs as well. So we're trying to get thoughtful and experimental on meeting the needs of these outreach mobile teams that are out and about doing things. But there's still just a lot of unknowns. And I think the Wellness Wednesdays is just one example of experimenting on how to fill that gap. But we still have a whole lot of questions.
Okay.
Yeah, and just one thing I've seen in that collaboration is funding here, support there. There's potential to put things together to solve the APRN problem. Jonathan and I were talking the other day. Jonathan, the 72,000 would help to extend the number of days that Wellness Wednesday could happen, right, versus beyond once a month, which is what's happening now. But if that were funded and we had a solution on the APRN position that could be shared between EMS, between public health, between the county, then we might be able to solve that problem permanently or that challenge permanently. But it is not ready to be considered in that way.
Okay.
Jonathan, a follow-up. So the 42,000 that's in the supplemental request for Wellness Wednesdays, is that for the second half of 2025 only? Is that for half a year?
So it's to continue it once we anticipate that grant running out. So we basically made our supplemental request. We did one for the city as well to equal about $70,000, which is what we're using right now. I think it was like 63,000 around that dollar amount. That's the grant that we have. So we're using that supplemental request to basically take the place of that grant.
So, but it would be only half a year. It would start in July or so of 2025.
Yeah, that or whenever we expand the grant. So the other thing too, the whole reason why we even do it once per month is because we wanted to stretch it out for as long as we can. And we actually have to use that grant by August of next year. So by August of next year, we won't have the option to continue that. I will say, well, the grant has been great. It does have its limitations. So because we have to have people fill out our paperwork, but because it's a grant, they have to fill out HUD paperwork as well. And we've had several guests who, they're good with our paperwork, but then they see the HUD paperwork and they're like, no. So we're looking at it to this supplemental request as a way to also eliminate barriers to see more people with it.
Liz, you made mention of mobile response or mobile health care through Heartland also. How is that related? Do you have we have a dedicated vehicle with Lawrence Douglas County Public Health. What infrastructure do you bring to that, and is that currently going?
So right now, because one of the things that isn't provided when it comes to what's happening on Wellness Wednesdays is that continuum of care, that primary care that's necessary for someone's overall health and well-being. And we take those referrals from that appointment and kind of manage that ongoing care for those individuals and bring them access to integrated care. So that's our dental, primary care, and behavioral health services. In the original proposal that we were working with the mobile, the healthcare for the homeless team, it included a smaller mobile unit that would allow our care teams to be able to go out into the community and provide clinical care on the streets. And because of the regulations of what we'd have to put into scope, that's why it was a separate vehicle in our original proposal, but understand that there was not funding for that original proposal. So right now, that partnership is just a referral and also working with those community health workers, our community health workers, to connect with those. I don't know, Julie, if you want to add to that.
The other thing that we've been doing is a quarterly pop-up clinic in collaboration with Lawrence Memorial Hospital at the Jubilee Cafe. So we've had a provider, a Heartland provider, and then volunteers from Lawrence Memorial Hospital, as well as some other clinical staff and our community health workers once a quarter at Jubilee Cafe, and then have helped facilitate folks from those initial assessments into primary care and other services at Heartland.
I'll add one more thing.
Commissioners, do you have
if we
other
have-
questions for this group?
The one thing I'll say is that, so we do every Wellness Wednesday, and when we want to keep doing it, we always have an APRN there. So, in Kansas, APRNs now can do just as, they don't need a supervising clinician or anything like that. So one of the things that we're working on with our APRN is almost to have them serve as like an urgent care. So like when we go, we can take the mobile unit anywhere. Like this month we'll be at the Pallet Village. So if they need, urgently, what do you need right now? We can help you right now, and then also get you over referred to Heartland, so.
Thank you all. Commissioners, do you have other questions for this group, or do we want to move?
If Jonathan could stay, that'd be good. And I'd like to hear from DECA next, if that's okay
That sounds
with
great.
everybody. And while DECA's coming forth, Sarah, on Lawrence Douglas County Public Health, we have 58,000 for suicide prevention programs. That's included in Bob's report, but not on our budget options. Is that a similar situation as the other one?
Yes, so I will have Bob get with Jake afterwards and make sure, and Cammie, and make sure that we're consistent on what was included.
Thank you. Hi. So one of the questions I had, both of these organizations are looking to do education and in prevention. And I'm just interested to hear two questions: how you've worked together to sort of make sure we're not overlapping, and then what maybe you've done to work with the school districts, because they have money for vaping, they have money for opioid settlement. Those are, I might be wrong on the opioid settlement, but I know they have money for vaping. Have we accessed money through them as well? And those are my questions.
So I might start, if you don't mind. So we actually have worked with Lawrence Public Schools related to some of the Juul settlement. So we are engaging, well, with Dr. Johnson's departure, I'm not sure where some of that stands, but we work with KSDE on a vaping echo, which really focuses on non-punitive supports for students who are caught vaping. And so we're working on engaging that into evidence-based strategies that can result in some money from other state agencies to support some of those vaping interventions. Additionally, our team has tobacco treatment specialists that we offer free of charge to the schools to be able to do some of that work, but we have not received funds specifically from the school for that, but rather we're trying to find ways to partner to leverage different funding.
And so for us, it was about a month and a half ago, we met with Dr. Lewis and some of the school district team just to learn about what their efforts were with, because we heard they got that Juul settlement, and we do tobacco retail licensing, so that's a good tie-in. But we haven't had a meeting with them since then. So the next step was to find out, what were they going to do with the Juul settlement. But our request related to education, it was more so towards the zero suicide effort. So we have a small zero suicide grant right now at our clinic. It's about $22,000, but it's not for us to provide education. It was for us to implement zero suicide. So for example, Headquarters Kansas, they were training us on how to do zero suicide because they had the grant to do the education. So with us now getting that grant, about a week and a half ago, we posted that position for zero suicide program coordinator. And so it's a new field for us doing that. So we're, going to get the person hired and then see what we can do to collaborate along with DECA as well. And I believe DECA has also benefited from some zero suicide education at their organization as well.
Lori Alvarado with DECA. We have implemented zero suicide as part of the Douglas County initiative, and so we have zero suicide across our entire organization and continue to support that internally.
A question for both Bob and Jonathan. And this is about, in Bob's budget, we have a fairly large number for data collaboration, which is listed as being part of Lawrence Douglas County Public Health. But within the Lawrence Douglas County Public Health budget, it goes from 30,000 of past dollars that have been put towards data repository to zero. So are we pulling all that back under admin and talk about the increase? The increases that we see across those three budget line items.
So the behavioral health admin area of the budget has always been focused on contingencies and to have the ability to respond to new opportunities and new requests. The $30,000 that has been allocated over the last couple of years to public health has been specifically focused on a data repository project. Since Jonathan came on board and we've gotten back into the work for the data repository project, there's conversations with new partners on that. And so we thought it made the most sense to pull those dollars back until we had clarity on what the needs might be to provide additional funding. So the dollars are available. They're not new dollars. It's not an increase. It just rests with the county because there may be increased costs, for example, with the work we do with MyRC. So data collaboration, there are several components to it, and we thought it makes the most sense to pull that back so that we can allocate it as the opportunities come and we have more clarity about what specifically that would fund.
Is that all the increases you were looking at?
Well, there's also the miscellaneous expense, which the previous one was wrapped into that data collaboration line. And then there's an almost 300,000. And I think you were talking about when we were having conversation, this is like a placeholder for future work, some of which we don't yet have kind of fully fleshed out. So it could, if we approve this, it would live in our budget. And then those things would have to come to us individually for funding.
Yeah.
Okay. And so we can hear more about that probably at a future.
Well, and we also, these commissioners identified, we could move the specialty court funding to the behavioral health budget as well. So this is just a budget that allows us to have that conversation.
And there are projects such as a comprehensive SUD needs assessment that is also in there anticipated.
Commissioners, any other questions for this group? Okay.
Thank you.
Any questions for Headquarters Kansas?
It might just be easier for you just to ask which ones you still have questions for, because I've got a couple people online and so forth too.
Because I would like to take our three new partners at some point. The Mirror Inc., Cardinal Housing, and 9th Street Missionary, if commissioners are ready for that. Yep. Okay, so go ahead.
I'll ask on a break. I just have a question for Sarah about something in our budget book.
Okay.
So, yeah.
So if you'd like to come up from Mirror Inc., Cardinal Housing Network, and the 9th Street Missionary Baptist Church.
Okay, so the 9th Street Missionary Baptist is in the panel, so I'm going to move them into the panel.
All right. Welcome, everyone. Been very remiss in not having people give their names and affiliations, because they're mostly folks that we've known. We have new partners at the table, so if you don't mind, giving us your name.
Sure, I'm Nick Casarona, Regional Director with MIR.
Nice to meet you.
I'm Jason Griever, Vice President of Treatment Services with MIR.
I'm Hannah Bolton with Cardinal Housing Network.
And online we have?
I'm Takesha Derritt with 9th Street Missionary Baptist Church.
Thank you.
And I'm Chris Berger with 9th Street.
All right, thank you.
We also have Brenda Wall from Family Promise on for 9th Street as well.
All right, let me flip my book. So I'll start with Mirror. You're a new agency to us in terms of county funding requests. We've been working in Douglas County here already for a little bit. We don't have any budgetary history from you, and I'm not so much looking for, what the county has done, because this is new, but this is one of the things I use to evaluate the health of the organization that we're then funding, and just part of our transparency to taxpayers. So and actually all of you, all three of these organizations have, no budget history, and I know Hannah's organization is brand new, and that would be why. But anything you can provide us before our Thursday kind of time when we're drawing up our budgets would be super helpful. Can you talk about the work you've been doing in Douglas County to date and how that's going?
Thank you. So historically, we began providing outpatient SUD services here in Lawrence in 2018 and have continued providing those for some time at the 3205 Clinton Parkway location, and also within Douglas County Community Corrections. We also have the Work for Success program here in Lawrence that came here in 2023, which provides personal and professional development services, employment supports, intensive case management services for, it began with parents who had a child support obligation, non-custodial parents. It's expanded since then through some other grants, and now serves a much broader population, providing that scope of services.
So maybe it's for Hannah, maybe it's for our friends from Mirror. I'm excited to have more substance abuse supportive housing for females. We have that with DECA as well now. What does it take to get male supportive housing for substance abuse in Douglas County?
Anywhere that there's a need and a pathway to get there, Mirror is a willing partner on most things related to substance use and treatment in Kansas.
I would say in terms of folks that I've been collaborating with here in Douglas County, Artists Helping the Homeless has been doing wonderful work in the men's arena. I'm sure you'll hear from them in the presentation, but I know that the demand is continually high and there's always a need for additional housing. So they are providing that service. They provide a lot of wraparound services as well.
Maybe just clarify. Didn't want to leave Artists Helping the Homeless out, but I do believe that our program with Artists Helping the Homeless is significantly related to those populations that are coming out of the jail, which is a little different than what I'm looking for, which is people in our community struggling with substance abuse and looking for housing. So
I had a question for 9th Street Baptist Church, and that is, I know that you have the $300,000 from the City of Lawrence through the Affordable Housing Advisory Board, and I just wondered, because much of that project is new to the county, if it would be reasonable to ask if you could submit just what you'd submitted to AHAB, so that we'd have that background also.
Yes, we could definitely do that. Thank you.
Okay, all right. Not trying to make a burden, but I think we'd all be really curious to know more. I think it's a great project.
Thank you.
No other questions for this group?
I don't want to take up too much time with this because I think, I have a grasp on it from reading the narratives, but I would like to hear our two partners at the table here between Mirror and Cardinal about what that relationship that you envision in terms of the direct treatment provider. Can you just talk a little bit about that model and give kind of a high level explanation of how you see that functioning between your two organizations?
Yes, I'm happy to pass off in just a moment, but in terms of the operations at Cardinal Housing Network, it really is focusing on the housing piece. One of the things with continued conversations with community partners was, how are we going to fill residents' time? How are we going to fill that with fulfilling challenging growth type opportunities to enhance their recovery outcomes. One of the things that as a new organization, I do fear that in terms of finding grant funds to kind of build capacity, it may take a bit. And that's why we decided to explore this partnership where Mirror Inc. could bring in intensive outpatient services as well as case management services into the home to give those folks specifically in that First Step house at 1046 New Hampshire a really comprehensive experience. And they're really honing in on those first 90 days of recovery, making sure habits are set, getting lots of exposure to what other resources are here in town, but also having someone who is a clinician who can come in and provide a service that I personally am not accredited to do. And so I think that utilizing their expertise in the treatment side of things could really enhance resident outcomes and experience.
So yeah, I would add that, adding the intensive outpatient piece to the housing model so that the ladies in the house are receiving that level of service while they're in the house, but also bring a connection to the wraparound services through the other partnerships that we have in the community that we've been working with, Heartland RADAC, and having an expanded ability to provide the transportation for the ladies to stay connected to the community resources, whether that be to meet with their intensive care coordinator at Heartland RADAC or 12-step meetings in the community, but trying to address that barrier of the transportation piece and the collaboration with the other community partners to keep the ladies there connected to services throughout the continuum of care.
I'll just note that I do not currently have a proposal for a transportation program, so this would relieve a very significant burden that I anticipate being upcoming.
And also, Hannah, as a new nonprofit, you have a fiscal sponsor currently, is that right?
Yes, correct. Both Douglas County Community Foundation and Tenants to Homeowners have provided that service for me.
Okay, thank you.
I also received correspondence from the IRS July 1st that they are hoping to expedite the application based on this grant cycle.
Okay, thank you. Any other questions for this group? Okay, I don't want to rush anyone. All right, thank you. And can we have Artists Helping the Homeless and Bert Nash? And if anyone has questions for Headquarters Kansas, okay. Thank you. Come on up. And just really quickly, I know we missed this on the first few, but if you'd give us your name and organization.
Sure. Patrick Schmidt, CEO of Bert Nash.
I'm Carl with Artists Helping the Homeless.
Dustin Moore, Artists Helping the Homeless.
Russ Tansley with Artists Helping the Homeless.
Thank you. Commissioners?
Stephen O'Neill, Bert Nash.
Who would like to kick off?
Well, maybe with Artists Helping the Homeless, you all are asking for a COLA, and considering that we're 68% of your budget, I understand that. I'm also looking at your fund balance, which is higher than your overall. I mean, it's significantly high. Have you thought about using any of your fund balance to fund your COLAs at all?
Well, thanks. The fund balance is, I'm sorry. The fund balance is primarily in real estate. So it would be a borrowing situation. We would.
So you're including in your fund balance,
right?
That's actually your capital holdings?
That includes some capital holdings, yes.
It does. Interesting. It shouldn't.
Oh, okay.
Yeah. Okay.
We can take that out.
Thank you.
Is that something that we could ask for? Is a new budget sheet here that has what the fund balance actually is, and then also that the line that's total revenues rather than total revenues and fund balance, those numbers don't add up. So it'd be good to have that. Backing up to last year, so we helped to pay off some debt last year. What has that done to like overall budget?
It's reduced our expenses, our cash flow, by about $30,000. About half of that was interest, and so the $15,000 came off the budget.
Thank you. And I'm just scanning for that here, for where that came out of your budget from the 2024.
You want to see what we're looking at?
Oh, I see. So yeah, debt payments are listed as as in the adopted budget for 2024 is 30,000 and then gone. Okay, got it. All right. Any other questions for Artists Helping the Homeless? Bert Nash, we did hear about one of your projects at a regular commission meeting, so we'll probably have fewer questions about that because we got to bug you extensively on the Youth Recovery Center campus. The other piece is so that this is probably more of a Bob question, the psychiatric services, we've got several lines in there, one for Bert Nash and one for Heartland.
Yeah, so Bert Nash's funding stays consistent from where it was last year.
Mm-hmm.
And that would represent 69% of the gap between their overall deficit in their med services. Heartland's request would offset 40%. So given that, because Heartland and Bert Nash, for several years, Bert Nash was the only player in bringing providers to the table. And so that has shifted over the last 2 years. And so that's led to more conversation between those two agencies through the psychiatric infrastructure group. And so that was the recommendation.
And we also have a COLA request as a supplemental. Can you talk about the role of your other funding mechanisms in meeting that need?
Yeah, I'll let Stephen jump into that because you know that's his world.
Yes, so our COLA request is based on the Medicare Economic Index, which is the same index that's applied to our state cost report. C works is it funds a portion of what you do proportionate to your Medicaid population. Because we don't have Medicaid expansion, even every time we bring a new Medicaid dollar in here, it's good, but it also increases our gap because it increases our total cost, and CCBHC is only paying for 60%. So our hope with the 219,000, which I think our total budget next year is 45 million, that 219,000 would help us pace with the increased revenue that's coming in from the state.
I also noticed that your fund balance is small compared to your annual expenses. What are the kind of vulnerabilities or plans around that?
So the first 3 years of CCBHC, we were prevented from making any sort of surplus. It was entirely cost-based. And in the model, if you generate a profit, you can be subject to reconciliation and pay that money back to the state. 85% of Bert Nash's revenue is cost-based. All of our revenue from the county's cost-based. All of our state revenue's cost-based. And it's hard to generate a surplus margin on a $45 million organization from 15% of your business. The state has changed that now that they got the federal demonstration grant. So over time, we're hoping to improve that, but the reality is all of our money has gone into providing services and increasing wages for our staff.
And then Burton Ash also has a foundation. So how does that interplay?
We took $1.5 million out of our foundation to become a CCBHC. That was an investment that our board chose to make. And so that was at the time, I think our foundation was it $6.5 million? So we took $1.5 million out of that, which you might imagine, given our fund balance, we've not returned.
Commissioners, do you have other questions?
Just a quick one. You do get some funding from the city of Lawrence. Do you have a similar COLA request from the city of Lawrence as well, or any other municipalities that we serve?
So our funding arrangement with the city is very simple relative to this. It's very transactional. They're paying for specific things, and our request does go up proportionate to the cost of those things. So they're buying specific FTEs, and that we do, that does go up. Yep.
Well, and as I look through your budget, we pay for some very specific things also. So it's not really just an operational funding. You have a lot of line items here.
That haven't necessarily increased.
All right, I think that's all the questions we have for the moment. Thank you very much for being here.
Thank you.
And actually, I think that wraps up our conversation around behavioral health. And if we can take a 2-minute reset break, and we will have, I thought I checked in.
Oh, yeah, I didn't have any more questions.
Okay. Okay, we have a request for a 5-minute break, and then we will just work on targeted populations.